Welcome, everyone. This is Mayor Steve Haggerty. We are live on Facebook as well as our local Evanston Channel 16. I am excited for our series on policing today because we're going to talk about alternative policing models. And we have guests with us from Olympia, Washington, and Denver, Colorado. And we also, as usual, have our police chief, Demetrius Cook, along with two of his Deputy Chiefs, Deputy Chief Secluti and Deputy Chief Aretha Barnes are with us today. This is our second to last in the series that we're having. Altogether, we'll have had 9 conversations. Next Monday, August 31st, will be our last one, and we are going to have a conversation with Evanston Black youth to talk about their experience with policing here in our community. So I expect that will be a well-attended session. So today we're on to alternative policing models. What I thought I would do is I'm actually going to start with some questions that people have emailed in prior to this. And so I'm going to direct them to you, Chief Cook, or to your deputy chiefs. And this will give our guests sort of a flavor of how we're handling homelessness right now, or issues of mental health, situations that come up and individuals call 911. So Chief, could you just give our audience and our guests a feel for how often the Evanston Police Department conducts well-being checks, and how often are police called to assist and respond to homeless individuals in Evanston?
Good afternoon, everybody. The homelessness issue in Evanston is kind of pervasive. We have a large number of homeless people. And I believe the reasoning behind that is the homeless population in Cook County understand where they can get good service. Evanston has always been a pioneer in helping the homeless from the inception when they opened up the 607 Lake Street Church in the 80s up until now. Evanston takes great pride in dealing with the homeless. So we do get a large number of homeless calls, and normally what'll happen, that call will come in through 911. We'll send a police officer, and what we try to do is get that person the treatment. A lot of times they'll be in a violent state because of lack of taking their medications and so forth. So we'll take them to the hospital, and that becomes a revolving door type deal. They'll get intake into the hospital, and then the next day, more than likely, we'll see that person out on the street again. In the wintertime, when the person is not necessarily suffering from an episode of some sort, we transport them with the assistance of Connections for the Homeless, which is a not-for-profit agency here in Evanston that deals with the homeless population. Either they'll come out and assist us with getting placement or shelter for the homeless person, because after 7 o'clock, a lot of these homeless agencies will not intake any additional patients after that time. So Connections for the Homeless will make sure that they can either get into one of these places that may have shut the doors for the night, or we'll provide transportation for the homeless person to a location in Chicago. And we do that on many occasions. You have a lot of population of homeless people sleeping in the bus shelters, sleeping on the CTA train platform, sleeping in vestibules of apartment buildings. So that is a very pervasive deal. The other deal is we do a significant number of check the well-beings. A lot of times when we go to these locations to check the well-being, it's usually a call in the 911 or through the desk where the family member or friend is saying that they haven't heard from their loved one in a number of days. they have went to the location and they see the mail piled up. So what we do is we'll go there and check, and we'll make entry in good faith. Years ago, the state of Illinois kind of exempt the police department from being held liable when they make entry into a residence in good faith to check on the well-being of a person. Now, sometimes we go into these locations and we'll find the person may have passed away. Sometimes we'll find that they're there and they just don't want to be bothered. But when we leave there, we're going to have complete resolution as to where that person is. And then we get back to the family on that. We get a significant number of them. I think that's like the top third call in in the services that we deliver.
Yeah, that's what I remember, Chief. I mean, the well-being calls, and if at some point you can pull up like the total number and just share that with the audience again, that would be great. But I remember it being, in the thousands of well-being checks throughout an entire year that officers do. Before we go to our guests, can you talk to us? You mentioned Connections for the Homeless, and Connections is really one of the significant organizations in town that works with housing and homelessness issues. They're doing a lot with COVID-19 because we do not have a permanent homeless shelter here or an overnight shelter. We don't have a permanent one in Evanston. We also have Interfaith Action, which is a consortium of these faith organizations that do provide emergency shelter. But because of the nature of COVID-19, we have put a lot of homeless into the hotels here in Evanston, which has really put a lot of homeless downtown, whereas before maybe it was more dispersed throughout the community. And I know the police work really closely with Connections, but can you just talk about your collaboration with other community partners and how that works? And then I'm going to turn to our guests to have them talk about the programs that they have in their community, Chief.
Well, we work with many agencies, but I'm particularly fond of working with Connections for the Homeless. Sometimes we'll run into roadblocks where it's a disconnect between what we actually want to do with, I'm going to call a homeless person a customer in this situation, and what Connections for the Homeless is capable of doing. But when I run into those roadblocks, I make a call to Miss Betty Boggs, who's the director there, and we always find a resolution to what the problem is and how we can solve it. So that's what I really like about how she operates Connections for the Homeless. She's never told me no. It's always, we'll find a way, and just bear with me, Cook, and I'll get back to you in a minute, and she always does. So that makes our job when we go to these situations with the homeless pretty good. We also work good with a number of youth organizations such as YOU. That's in the Fifth Ward. It's on Church Street, and that is a place where youth have refuge. It's where they can go utilize computers, do their homework, get tutoring, and have a place of safety without, I guess, a lot of police involvement. If they're experiencing a problem versus making it a police problem, they can go to YOU and come up with a resolution that may be appropriate. But I've never experienced an issue with YOU, whereas if something truly was a issue that the law enforcement agency should get involved with, that they didn't help us with that. So, YOU, YWCA, we deal with them a lot on the domestic violence. They provide shelter for a lot of women that are battered. They do that around the clock. I had the experience when Evanston cut the social workers here at the department, and then when they brought the social workers back in conjunction with the YWCA, I got to see the professionalism in those ladies that work for the YWCA, and I thought they were a really good asset, and they have been an asset the 40 years that I have been in law enforcement here in this town. So it's a collaboration on many levels. As you know, Mayor, I'm on the mental health board, on the mayor's mental health board, and it's got to be 50 or 60 mental health not-for-profits there, and I've been in many a problem-solving situation. When we look at service delivery, who's available at night, who's available in the daytime, that gives, by being on this board, that gave me better insight on how we can collaborate with our social workers and other social workers throughout this district.
Thanks, Chief. I think that gives us a good foundation. There's also a whole victim advocacy group that we have that's in our Department of Health. It used to be part of the police department, but there's a tight liaison. Is that right, Chief, or did I mess that up?
If I may, Mayor, we have social workers here. We have 2 professionally licensed social workers here. They were a part of a larger social work network that we had exclusively in the police department since 1976, when Chief William H. Logan pioneered social workers within the police department. We also had 4 youth outreach workers that worked with troubled youth and youth that were going astray and could possibly at some point be termed delinquent. We did peace circles, we did restorative justice. When Chicago police started their peace circles and restorative justice programs, they came here to Evanston to see how we did it. So we've always been progressive in that sense. And I'm glad that we're able to get 2 of those social workers back here, even though they work out of Health and Human Services. I think that has tightened up the relationship between these 2 departments, meaning the Evanston Police Department and Health and Human Services. So it's a lot of good that came out of them coming back, but still being under the management of the health department.
Great. So so after George Floyd, Breonna Taylor, all that has happened out there, we have had a commitment in Evanston to do a real deep examination, possibly reimagination of policing in Evanston. There have been a couple best practices reports, big reports that have come out, one from the U.S. Conference of Mayors that came out recently, another one called the New Era of Public Safety, which was the Leadership Education Fund and the Leadership Conference on Civil and Human Rights. We have had staff in the city manager's office review both of those, and I'm really pleased that in Evanston, we're doing a lot of those best practices already. I asked her to bring to our Human Services Committee on August 31st a memo that sort of summarizes her review of those and those areas where we're not doing certain things, so we can share that with Evanstonians and our residents. Part of this, reimagining and rethinking policing is considering whether there are activities that we have our police doing that may best be performed by others, whether it's a nonprofit organization, whether it's another agency within the city, that's still ensuring that our city remains a safe place, but maybe provides the circumstance with a better solution. And so today I'm really pleased that we have guests from Olympia, Washington, and Denver. And so I'm going to let them introduce themselves. Chris, why don't we start with you? And if you could just, share with people, what the Denver Star program is, what your role is in that, and how it came to be, a little of the background, that would be great.
Sure. I'm Chris Richardson. I'm the Associate Director of Criminal Justice Services with the Mental Health Center of Denver. The Mental Health Center of Denver is the largest nonprofit mental health provider in the city. And what we kind of took on this year just kind of came out of our original co-responder team. We have clinicians that ride with officers that started about 5 years ago. Started out with 4, and just through kind of like that partnership, the good work, and being able to respond to people in a very trauma-informed, humanistic kind of way, and connecting them with resources, we were able to expand our co-responder team from 4 to where it's at right now, which is 32, and that's providing services throughout the entire city of Denver in partnership with our law enforcement partners. What we realized pretty quick in January 2019 is that there was still a lot of stuff coming across 911 that officers were taking on that we just kind of were just like, is this something that they actually need to shoulder? They are asked to shoulder a lot in the community. Anything that comes across 911, they're the first ones that are responding, regardless if there's law enforcement or not. And that's been going on for a very long time. And so we just kind of did some internal investigation and heard about this CAHOOTS program in Eugene, Washington. I gotta be honest with you, I don't know how they kept this program so quiet for so long, but they've been running it for a decade plus, where it is a civilian social work type person riding with an EMTB and responding to low-level 911 calls where there's not a safety concern, but there's either a behavioral health crisis or something that doesn't require a law enforcement presence. So Denver, a huge contingent of Denver staff went up there, the Mental Health Center of Denver, Denver Police, 911 Comm Center, Denver Justice Project, the Harm Reduction Action Center. And we basically went up there and did some ride-alongs, took the information that they had on here's a different approach to responding to people that really just need help and need something either from a solution or a system navigation or something like that. And we brought that down to Denver. And after about a year of kind of talking and being able to get some funding attached with it, we launched a pilot June 1st of this year. It is a licensed social worker riding with a Denver health paramedic. And it goes 10 a.m. to 6 p.m. Monday through Friday is just part of our pilot initiative, primarily in the downtown corridor area of Denver. And so far, over the past soon to be 3 months, we've been over 350 calls for service. Not one of those has led to us having to key up requesting police backup. We were able to resolve most things on scene. And if we did need something like an ambulance, we were able to specifically request an ambulance versus kind of like the previous system, which was everyone kind of shows up and assesses who needs to be there and leaves from there. And what we've noticed is a different take on being contacted by us. It's I'm actually probably a little more dressed up than I normally would be. I'm usually wearing a t-shirt and jeans and jumping out of a van and kind of talking with someone who's dealing with something that just it's catching them on a bad day, and they just want some relief attached with that. And sometimes it's a compassionate ear, sometimes it's transportation to a certain location, sometimes it's I just can't get through the front door of, I want mental health treatment, but I don't know how to access it, and being able to do that in a way that's pretty low barrier. And then it's also kind of just a humanistic harm reduction based approach of, we go on calls occasionally of individuals that have fallen asleep on the sidewalk, and us just being able to very nicely wake them up and say, hey, where can we get you to? Can we get you to at least a bench under a tree? Keep you out of the sun. Here's some water. Here's some resources. Anything else you might need? And that approach is very different for people. They get a little weirded out that we are coming across so nice, is what we keep getting. It's like, you guys are being nice. Why? What are you doing that for? And it's just like, it's a different take and different way to connect with people in a very humanistic kind of way. All these calls are coming across 911 call center. And they're being identified as when the call taker is taking it, as long as there's not a safety concern, it's something that we would be able to respond to. And if it kind of raises where it is a safety concern, it's nice because Denver has the ability to tap into a co-responder model where a police officer will be able to go with one of our social workers. So it's really a tiered system of responding to the right call with the right response. and being able to determine whether or not if law enforcement's not needed, then the STAR van can take it on. And if it's something that law enforcement is needed there, then a co-responder can be requested. And if it's something where it's just beyond the scope of even a social worker being part of, then a police kind of take that on and request us as needed. So it really is the right response to the right situation.
Chris, I want to understand, you started off, you talked about a program where you had 4, I'll call them social workers, right, that went out with the police.
Yes.
And then you increased that program all the way to 32, which is huge. And I recognize Denver's a huge city and everything else. But then you talked about the pilot program that started on June 1st. And so the pilot program, the difference between the other program and the pilot program is literally 911 is sort of triaging that call and making a decision about, you know what, we don't have to send a police officer, we can just send a social worker to this.
Exactly, and they're going based on their kind of like triage process, and as they go through that, if they're like safety is not a concern, then we send the STAR van to this call. And there's been a few occasions where they'll actually say, hey, can you give us a call? And they run the scenario by us, and we tend to be like, yeah, I think we can take that call on, not a problem. And it just helps expand the idea of like what calls we will go to and what we won't go to. And what we've noticed right off the bat pretty early is that about 40% of our calls are actually officers that are on a call and recognize that this is not something they need to be on, and they will call us in and we kind of tap them out and say, yeah, we can cover it from here. And being able to kind of relieve them to go back and do the services in the community to keep our community safe. And then the uniqueness of the STAR van is the ability to transport people. COVID has definitely changed a lot of service providers' ability to engage with the community, specifically with a lot of like ACT services, sort of community treatment, which would be maybe possibly being able to transport an individual. And the STAR van, it's a big space, and we're able to do it safely, where we can say, can we get you to a shelter or to get your meds or to, whatever it is in that moment that's going to help alleviate some of your stress attached with the crisis you're going through. We'll be able to help do that.
Is STAR, this program, is it part of the Denver Police Department, or is it a nonprofit and a separate group, or just a separate unit somewhere else in the city?
Yeah, so right now the contract is held by the Denver Police Department or the Department of Safety, but they contract out with the Mental Health Center of Denver, and then we have the Denver Health, which is our local hospital supplying the paramedics at this time.
Interesting. Okay, let's we'll go back and forth with questions and all of that. And Chief, I want to ask you and the deputy chiefs, if you have a question or anything, feel free to just raise your hand or whatever. I'll call on you so we can make sure you guys get questions answered as well. You have a question already? Okay.
Sure, yeah, I got a question for Chris. Chris, do you all find it problematic with the social workers responding with the police, just that association in today's climate being looked upon as a negative thing? Or is it, does that create an issue with that association?
I think it depends on kind of what lens you're looking at it through. I mean, I've always been a fan that if we can help support someone that's in crisis in any way that mitigates it, where jail is not the end run, and honestly, the hospital, like that's a positive. And I'd rather be there, with the partnership of police next to me than not. I think it's really important to kind of be that 21st century policing model where we have, we're able to provide additional services and support to officers that previously they didn't have. I think it's an important partnership at the end of the day, and I think something that really has impact on the community.
Chris, a quick question: do you know if Denver police also get trained in crisis intervention?
They do. About I think 98% of our guys are actually trained, and I think it's just part of the standard training as they come into the department. And I think it's also having a social worker with you. It's not just us taking a call over and being able to mitigate the crisis from where we're at. We're actually bringing the officers into that conversation as well to kind of change that how the badge is used as well. Like we want to make sure that this is it's a co-response. It's coming at this as how do we solve this problem as a team and as a whole community, and not just saying officer sits back and doesn't do anything. They're part of the conversation of how do we help this individual. And we're just the tool and instrument to be able to do that with low barrier and using our resources that we have on hand.
Great. Let's turn to Olympia, Washington. We've got our guests, Ann Larson and Amy King, who's the lieutenant there. So could you talk about the Olympia's crisis response unit and how it originated, similar to what Chris just did with the program, with the STARS program in Denver?
Yeah, sure. So like Chris, our model is based off of the Cahoots model from Eugene, Oregon. So our chief of police that just retired this past December was from Eugene, and so had always had in the back of his mind how successful the Cahoots model was when he was working in Eugene as an officer. And so he had always had that as one of his goals moving forward when he became chief in Olympia. So in 2017, the Olympia Police Department and the city of Olympia put forth a public safety levy. And so they asked the citizens of Olympia to vote upon this public safety levy. And part of that public safety levy funding was funding for like a mobile crisis unit and my position, and it passed overwhelmingly. And so it increased walking patrol officers, it increased neighborhood policing officers, it bolstered our community court, and then it created funds, $550,000 for a crisis response unit, and then $250,000 for direct services. And so then I got hired on by the Olympia Police Department. So I'm a civilian that works within the police department, and I work really closely with Lieutenant King. And we started to build what is now called the crew team. And we spent a lot of time in Eugene as well. And we were lucky enough to have Eugene come up 3 times during our implementation process and help us build our program. Something that's a little bit different here in Olympia, and I think it just depends on your jurisdiction, is that we do not have an EMT riding along with our behavioral health specialists. It all comes down to the fire department, and paramedics in our county can only work underneath the fire department, and we could get into unions and all that kind of jazz, but I won't bore you. So we have 2 behavioral health specialists that work in a Sprinter van, probably similar to what Chris has, which we got the specs from Cahoots. So we run our program 7 days a week from 7 a.m. to 9 p.m. We are teams of 2, just probably like Chris's team, but they're both behavioral health specialists. And I mean, I could echo a lot of what Chris had said, like the power to transport people. Our crew team members are on police radio as well. And the way it works here in Olympia is they hear all the calls for service that are happening in the city of Olympia. We're a city of a little over 50,000. And individuals can directly call 911 or non-emergency dispatch for the crew team. We have, so they can get dispatched from our 911 system. And then like what Chris said, a lot of times officers are on a scene and they'll request the crew team over police radio. And we also assist fire a lot, because a lot of our folks that we serve have chronic medical conditions. And so a lot of our folks are just really medically fragile in Olympia. And so we'll get referrals from fire as well. And I'll let Amy jump in.
Good morning. I'm Amy, and I do work for OPD, and this is not my uniform. I'm actually on vacation. I just moved, and so I didn't even know we were going to be live, so I apologize that I'm wearing Chris's outfit apparently today, t-shirt and jeans. But at least it's a picture of Washington, so that's good on my shirt. So yeah, I am currently an acting lieutenant that's coming to an end here soon. And then I'll go back to my regular position, which is the sergeant, and I'm in charge of, or a sergeant, and I'm in charge of our downtown walking patrol. And so prior to crew starting, walking patrol was funded out of the levy that Ann talked about. And so myself, and I have 6 officers, and we focus strictly on our downtown, either walking or on our bikes. We have a significant unhoused population in downtown Olympia and in the larger area as well. I think, as the chief talked about, people sleeping in lots of places that are not always best for other parts of the community or businesses. And so then, as Chris talked about, getting that comment about, oh, you guys are so nice. We really have made some shifts at OPD. And so kind of my crew, one of our first things in the morning was to go down and start helping wake people up in a nicer, gentler way, and helping build some relationships and starting connecting them to services, knowing that crew was coming on board. And then when crew came on board, we did some cross training, kind of helping them understand police culture and the way that we might be viewing a situation, or why we might be doing things that we're doing. And also just making some introductions to people. You know, Denver's huge. Olympia is not so huge. And so we see a lot of the same people and truly get to know them. The last thing I want to say before we move on is the chief asking the question about those associations between social workers showing up with police officers. I can't emphasize enough the importance of taking the time to build all the relationships with the people in the community that you're serving, the relationships between officers and social workers or EMTs or whoever is on your co-response team, and vice versa. Any time spent doing that, whether it's formal or it's casual, is time really well spent. It has served us very well, and it's, I think, served our community very well, because we may have different goals at certain times on certain calls. We might be trying to accomplish different things in specific situations, but at the end of the day, we are definitely all on the same team. And having the right people in the right seats on the bus and having strong relationships has paid dividends over and over and over again.
So one of the differences between the two models, so you're both using the Cahoots sort of framework. In the case of Denver, they've contracted out to the Mental Health Association that Chris works for, and so they've got that contract agreement. In the case of Olympia, you've done it in-house. You had the levy, and so the vote. Or am I messing that up, Ann? Because I want to make sure. I know people have an interest in understanding that part of the police department is separate from the police department. Yeah.
The funding comes from the police department, but we contract with an agency called Recovery Innovations. So they're contracted city employees. So they have city badges, they have access to the police department, but technically they work for a contracted agency.
Okay. But their contract, again, is with the police department, similar to Denver, and that would be similar to Eugene, Oregon, too, then.
Yeah, Eugene contracts with Whitebird.
Got it. Okay. So Chris, how did Denver, do you know how Denver went about paying for, this program? Was it, we have the whole defund police movement, right, that's been going on, that existed before, really this spring, I understand. But, the whole focus of that is, look at how much money you're spending on public safety. Can't we reduce that and invest more into crisis counseling or invest more into housing and everything else that's leading to some of these problems?
Yeah, actually in 2018, Denver passed it's called Caring for Denver. It was like an 80% approval by the citizens. It's basically a 25-cent tax on every $100, and that goes towards behavioral health specific programming. And it's not meant to supplant, but used to be a creative way to fill gaps in our system through funding. And that took all of 2019 for them to slowly get their, accrue the income. And then right when we got back from Eugene, we started the process of tapping into that funding as just a pilot to see what it would look like. And we're granted that funding in, I believe it was January 2020.
Okay. Chief, do you or the deputy chiefs have any questions right now?
No, that one, that funding question, that was what was on my mind. Was that a line item adjustment in you all's budget, or was it through some defunding process? And I think Chris did a great job in answering that.
We had a question from Alexandra that came in. And their question was, did Denver 911 dispatch callers need significant training in order to identify the differences in calls and dispatch the appropriate unit?
Yeah, now we actually got the benefit of having one of our head 911 director go up to Eugene and sit in an entire day up in their comm center and listen to the calls that were coming in and figure out how they triage their calls. And Eugene, Cahoots did a great job of being able to give us that information, and she brought it back to Denver and disseminated it to all her individuals. And then it really was just kind of fine tuning when someone's calling 911, how do you specifically ask questions that would be appropriate for a STAR response? Additionally, because we're only piloting in such a small area of Denver, we do have a specific phone number that we're hoping to roll out to the entire city once it becomes much larger. That would actually give an individual an access number. I think it's like 720-913 STAR. That way, when they're requesting specifically a STAR response, that they are getting that directly to 911.
Is there a belief in either Olympia or Denver that if you get this kind of program up and running, you can reduce the amount of money that you're spending on the police department because you're shifting away, some of these, or is it sort of net neutral probably in terms of cost? You know what I'm saying? How about Ann?
I hear what you're saying. So I think, there's a lot of questions about if you bring in programs like this, are you going to have more calls for service? We're really just taking calls for service that were already existing. And a crew response is going to be less expensive than a law enforcement or a fire response. A lot of what we do, so we track how the call was dispatched. And a lot of what we do is self-initiated. So our goal, our 4 principles are street outreach, harm reduction, trauma-informed, and culturally competent. And what I want our teams, everything we do is out in the community. So either on foot or in the van, is that if they see somebody having a bad day or in distress, or if they help somebody the other day and they know that they're going to be at the gospel mission and they swing by and check in with them. So a lot of what we do is self-initiated, which is you really want to prevent someone from calling 911 to begin with. Like that's like where it's at. And so I think it just frees up our officers to do law enforcement work, and it allows our crew team to really engage in the community and help them reduce the numbers of calls to 911.
Have you had in your program, the crew program's been in place a year now?
So we're up and running officially April 1st of 2019. So we hired folks at the end of 2018, and we spent a good 4 months training our crew team members and really getting them enmeshed in the community, because a lot of times calls for service might be like where someone can get some coffee or a shower, or what kind of resources do you need to have on board. And so I know people think when they see the numbers sometimes of how many calls for service that we go on, they think, oh my gosh, like the city of Olympia is in a chronic state of crisis. And it's really not, because we work really hard on not defining crisis. So I think Chris kind of said it too, is like, how do you get to yes? Like, how do we get to yes when a law enforcement officer calls and someone's missing their shoes? Is that, criteria for crisis? Yeah, if you don't have shoes, it's definitely criteria for crisis. And so I think just being super nimble and super responsive, I told my team from the get-go, if it's not unethical or it's not unlawful, we're doing it. I think just even listening to Chris, is that's their model too, is like officers need someone that's going to go in just like they're going to go in, and they're going to problem solve and help this person out. And sometimes it is moving them from the location on the sidewalk to another public space. That's just better off for them in the community.
Right. Lieutenant.
And from the police perspective, officers are so used to being the only response. We've been the only response for so many years. And so if you want to figure out how to get officers to buy in, it's have a program that says yes, have a program that finds a way to get to the help that is needed, because it only takes an officer contacting the crew team once or twice and having them be able to take over, and for them to be able to tap out and go to the next call and deal with a law enforcement issue, to make them firm believers and to be on board. And I think, I don't have the numbers, and I don't know if Ann does either, but I think we know certainly anecdotally that officers, I think Chris mentioned this, a lot of calls are now coming from officers arriving on a scene and realizing this is not something that we really need to be addressing or should be addressing, and asking if crew is available.
And that's your unit, right? In Olympia, you said that you oversee sort of 6 officers that are walking the beat in downtown Olympia?
Yeah, however, and so when crew started, they really did just focus on downtown because it was a smaller geographic area. It was easier for us to be available from walking patrol and to make sure that if there were questions or somehow that we could just assist, because it was a new program. But they will respond anywhere. They also didn't have their van in the beginning, and so going outside of downtown was hard because they couldn't get there. Came on, and they had some, and they now respond anywhere within the city. And so it's not, they don't just respond to walking patrol officers calling. It can be any officer at OPD. And sometimes we get officers from neighboring jurisdictions that will call as well and try to poach our services because they're so good.
If you weren't so far away, maybe we'd do that. So does the Olympia program work similar to the Denver, where a call to 911 is triaged and then they say, hey, we want to send out somebody from crew, or does it work?
Yeah, I mean, so sometimes people call and they are now familiar enough with crew that they will ask when they call themselves to have crew dispatched. Our dispatch center is a little hesitant, I think, to directly dispatch crew. But officers are really good at doing that right up front. Like when the call comes out over the air, it's not uncommon to hear an officer, tell dispatch, can you see if crew is available, and have them respond. And it may then continue to be a co-response until it's figured out that, yeah, crew really can just, if this is appropriate for them. Sometimes officers do respond because it's not clear from the information coming out over the air. And then once they get there, they will call crew. I know that because crew is on our radio, they're listening. And I know oftentimes they start kind of heading in the direction when they think, this might be a call. I've heard them get on the air and tell officers like, oh, we're familiar with that person, which is kind of, our way of them communicating with officers like, hey, this might be a better option for us to handle if you're good with that. So dispatch does do some triaging, but a lot of it actually, I think right now is happening after dispatch puts the call out.
Interesting. Okay. We had a question from Chelsea, and I think it would be similar to your community. So I'm going to ask each of you, what were the obstacles or the barriers or the concerns that people were expressing in within your police department even too, of putting these programs in place? Because prior to these programs, again, it was a police officer that went out and handled these situations.
I think the biggest thing from the police perspective was what I mentioned, in that officers are so used to being the only one to respond. And I can't count the number of times in the course of my career that there's been a new program and the promises have been made that they're going to be there and they're going to respond, or we can take the person to this location. Usually that's what it is. I can't think of one where they've been going to respond, but you can bring them here. We're 24/7, or you can call and someone will answer. And unfortunately, that has never ever been the case until now. And so I think when perhaps this was, there was first conversation about this, I think that was officers' most, their biggest concern was, is this just going to be another promise that is empty? And really there is no one that's going to respond. There's nobody that's going to show up. There's nobody that's going to answer the phone. I'm going to take them someplace and the door is not going to be open. And so Anne has done an incredible job, and the crew team has done an incredible job of figuring out how to say yes and how to show up and to problem solve. some really difficult situations sometimes, and some difficult issues to try and get figured out. But I think that was probably the biggest challenge. And then, officers also want to know that, and it kind of is tied in, just that we can depend on, that they're trustworthy and that they're going to do what they say they're going to do, not just in showing up, but that they're going to truly work to solve the problem and not just make it look like they're working to solve the problem. So, and that's gone a very long way. Again, it's about relationships, and there is a good relationship between our crew team and our officers at this point.
That's great. So skeptical about whether the program's gonna, is here to stay, and can they do, as good a job as I think I can do, responding to this as a police officer. Chris, anything else to add in terms of barriers or concerns or obstacles you people had there in Denver?
No, I'd second that there is definitely the, being able to be a resource that is able to solve some of the things. I think is like the second you solve one thing, like the officers like spread the word like wildfire, and that's what we're able to utilize. I think one of the biggest things from a lot of communities I've talked with around the nation kind of stuff is just general safety and us going to these things from a safety concern. And it's really trying to talk with people is this is a different approach to how we're engaging this population. It's not coming across as threatening. It's not coming across in any kind of confrontational way. I did case management for a very long time and was in areas of towns that I've never been concerned about. And it's just being able to come in there with like kind of a positive attitude and being able to really talk with people in a way that's different than what they're used to being spoken to, and not being, a lot of people think of sometimes social workers as shrinking violets, and these teams aren't these crisis is kind of what we do, and it's all versions of crisis, and it's being able to go out there and say, I don't need to, I'm going to make sure that I have my spider sense up when things seem a little bit weird, but for the most part, this is a population we're really good at working with, and we're really good at engaging, and just in different creative ways. And I think once we get past the safety aspect where people are like, oh, okay, like they're okay, they're going to be fine on the scene. They talk with this person that's really heightened and manic and all that stuff. It's like, it's just a Tuesday.
Right. I mean, I think that's the concern, right, that I hear is just the safety of, our social officers, because, that and, whether you can accurately and appropriately triage through 911, which again, I mean, it's these programs, like you said, the Eugene program's been around for a long time. It's been tested, and you're using it in your communities and finding that it's working well. And
for Denver, I think that's the unique part, is being able to, like, even if it wasn't correctly triaged and we get to a scene and all of a sudden we're like, we're on the far end of like what we're willing to be able to like, tolerate and deal with and work with. If we get to that point where we're just like, no, we're a little concerned, we have our partnership to be able to key up and say, hey, can I have an officer just for backup? And that trust and that relationship allows them to come in and know what we're doing, but also be there to kind of have our back as well. So,
Great.
It is definitely a partnership that's positive and needed.
Good. I know we're coming up on an hour, and I so appreciate you spending time. I'm going to give the Chief the last question before I wrap it up. So, Chief, go ahead. You're muted, Chief.
Thank you. I'm sorry. I'd like to know from each of the panelists, how are you all measuring success? Is it a mix of quantitative and qualitative analysis? Is it on the police side a reduction in the number of calls for service as opposed to when you didn't have a social work partnership? Can you all elaborate on that a little?
Yeah, so from our side, I think it's twofold. The city of Denver wants to see a reduction in officers having to go to calls, and they want to see, how often did we have the least needed mean attached to it to still solve the problem. The social worker in me, it's how many people are we successful in connecting to the next step that kind of progresses their life in a positive way, whether that is just not only resolution of the immediate problem, but are we connecting people with services? Are we getting them into substance abuse options? Are we connecting them with some version of a social support? I think that's what keeps people feeling like they have connection in a community, and also takes that, hopefully 911's not the go-to all the time. Instead, it's my therapist, it's my peer, it's my whatever that looks like, to be able to reduce the likelihood that 911 is the immediate go-to and more the social community aspect.
Great. I know we're coming up on an hour, and I so appreciate you spending time. I'm going to give the Chief the last question before I wrap it up. So, Chief, go ahead.
Thank you.
You have anything you wanted to add, Amy? Ian or Amy?
Yeah, I mean, I think just echoing what Chris said, is we track the amount of time we're on calls as well, so we can show that, like, we can spend an hour, 2 hours, 3 hours with a client where law enforcement really, I mean, there are so many calls for service that they really need to, like, respond, resolve, clear, and so we're able to spend a lot more time. We also have a program here called Familiar Faces, which our crew team can refer into, which has peers, so folks with lived experience in incarceration, addiction, mental health. And so if we're responding to the same person frequently, we can refer them to another OPD program and really do that work that Lieutenant King always says is, like, we can always find solutions that work, but what about solutions that last? And it really is connecting people to their community, to have someone walk alongside with them, because there's a lot of resources, but folks have it's hard to navigate. Even if you're housed and have a car, it's hard to navigate the systems that we have in place.
Great.
Yeah, the only thing I could add is I refer to data as kibbles and bits. It's my least favorite thing, but I know it's what everyone wants and is important. I like the stories, and it's always hard for me to put into a data point the relationships that I see that have been built and the changes in people's lives or in their interactions with, whether it's the police or it's our crew team, and their response. Those are the things that I think make lasting change. I think change happens within community. And so I like to focus on building that community. And I know we need to have data to support it. But at the end of the day, it's always my gut tells me this is working. I've never seen anything like this in the course of my career that has worked in the way that this has. And so I don't always have a number. We do keep track. We do have data and things that we have to collect. But I would just leave it at, this is a good direction for our profession to go.
Great. Well, you have one more question, Deputy Chief? Go ahead.
Yes. How long did it take to transition to these models where everyone was on board and you were able to see success?
Go ahead, Ann. You go first, Ann.
So, we had community buy-in and law enforcement buy-in, which from the get-go. So our chief was on board and our community was on board. So, we did an RFP, we did stakeholder meetings, we did officer surveys. Once we picked our provider, we were really up and running within, I would say, 5 months. But you really do need to spend a lot of that time building up and building. I was implemented or embedded in the police department, so I wasn't this stranger coming in promising things without connections, without relationships. And so I could send you all, like, the budgets and the RFPs and, officer surveys and all that kind of stuff, so you wouldn't have to recreate it. But we spent a lot of time figuring out what was going to work for us and how to implement it.
Thank you.
Great.
Yeah, I think our co-responder team, it was slow and intentional, just to be able to get that buy-in, and then over time we were able to expand it really intentionally. And then the STAR program, just being on the backs of that, we could have stood that up the next day, just because we had the buy-in immediately.
Well, I know we're up at our hour, and just a big thank you to Chris Richardson of the STAR program in Denver, to Lieutenant Amy King and Ann Larson with the Olympia crew, the crisis response unit team there. I know I'm going to hear a lot of positive things from people in the community. I'm already seeing it in some of the feedback on Facebook, that we really appreciate both of you and your cities taking time with us here in Evanston. I know we're not alone. There are many cities out there taking a hard look at what's the best way to, manage, mental health issues in the community, homelessness issues in the community. And obviously our police chief and the two deputies just spent an hour here on this. They're very committed as well to a full examination of all of this and figuring out what's best for Evanston. So I thank you both, all three of you, for joining us. I want to thank Patrick Degnan, who works behind the scenes but helps put on all of these sessions along with Anderson Castillo. We're going to meet again next Monday. Will be our last in the series on policing here in Evanston, and that will be at noon with some youth in the community who will be having a frank and honest conversation about policing here with them. So until then, be well, everyone, and thank you for joining us.
Hey, I'm glad I met you, Lieutenant Amy and Chris. Good luck to you. I appreciate your service.
Thanks.
Thanks, Chief.
Thank you. Thank you, everyone.